Welcome to Pursuit of Medicine, and before starting today's discussion, I am going to tell you guys a story. Now, our story is going to start with a physical fight happening between two people. Two people are on the road, they are fighting. A third person steps in and he tries to separate them, he tries to stop the fight. Now, what happens later on is what usually happened is that the third person who interfered and who wanted to stop the fight, he himself has got punched. Okay? Unconsciously or unconsciously, he got punched. And as soon as he got punched, he lost his consciousness and he was saved by the paramedics and he was admitted to the hospital and he was kept on a ventilator also. And later on the doctors, they found out that this patient has got head injury. And but they kept him on the ventilator, they kept on treating him. Within a few days his recovery was very good. And he started moving, he could walk now, he could talk now. And he was everything was good with him, and he decided that since everything is good, my recovery is going good, I'll go outside the ward and I will just light up a cigarette. Okay, so nothing's wrong with me, so I can go outside and I can smoke. So he went out of the hospital, and while he was still admitted, and with his friend he lighted up a cigarette. And now as he was smoking outside the hospital, this person again suddenly he went unconscious. And when he regained consciousness, he was limp, paralyzed. And after a couple of hours he again lost consciousness, and this time he was declared as brain stem death, and this person died. So that was our story. Now, by now, you must have figured out that this is not a story I am talking about. This is a documented case published in a journal, and this case is published by these people called as Milroy and Pergina. And this case forever has been noted down as Milroy and Pergina case, and it's a very important case in forensic. So, what had happened is that this person, when he lost consciousness, when he was hit by the initial punch and he lost consciousness, after losing the initial loss of consciousness might be due to concussion. And his neurological score, GCS score, was very low when he was initially seen, and he was put on ventilator. And initially the doctors, they found out through CT that he has subarachnoid hemorrhage, he has hydrocephalus, and he has all those changes of a case of a blunt head trauma. All of that was there, and they did a baseline angiogram. On the baseline angiogram done on day 0, there was no aneurysm present. Then they did a angiogram again on day 7. Then day 7 there was a 1 mm aneurysm at the pica, which is posterior inferior cerebellar artery. Then on the ninth day, this aneurysm became 4 mm. From 1 mm, it has grown to 4 mm. And on the autopsy, they found out that it was this aneurysm which has ruptured. So, this is a case of a traumatic aneurysm rupture. It's the trauma which caused the aneurysm, and the aneurysm expanded and it ruptured, and which led to the death of this person. Now, up to this point, everything that I have told you is just the story, just the chronology, what had happened, when it had happened. Now comes the difficult part. The difficult part is to understand why this case matters so much. And for that to understand, we need to step away from the story, and now let's look at the biology behind the story. Now, before we interpret this case, we need to clarify just three core concepts and nothing more. Then we'll go back to the case. But first of all, let's look at some basic concepts. Now, the basic concept is that what is a true aneurysm and what is a false aneurysm. Now, in the aneurysm, per se, a true aneurysm is the aneurysm which is having all the three layers of the vessel wall, all the three layers of the artery. What are the three layers of the artery? Intima, media, adventitia. All the three layers will be there in a true aneurysm. See, true aneurysm will be something like this. And if these are the vessel walls, 1, 2, 3, all these three, 1, 2, and 3, all of these three will be in the outpouching. Okay, all of them will be in the aneurysm. Now these aneurysms, true aneurysms, they are 99% cases congenital or 1% acquired, but they are not traumatic per se. The person is already having these aneurysms. He may be born with those aneurysms or he must have acquired those aneurysms sometime at the life, but they are not linked with any trauma. Okay, these are true aneurysms. True aneurysms in the brain are seen around the circle of Willis if present. Okay, this is a true aneurysm here. This is the diagram of circle of Willis, and true aneurysms are notorious to be present at the branching point of circle of Willis. ठीक है, तो ये लोकेशन को थोड़ा सा ध्यान में रखना. They are mostly present at the branching point between two arteries. If two arteries is there, aneurysm is at the branching point. Now what is a false aneurysm? False aneurysm is almost always traumatic. तो traumatic में क्या होता है कि if this is a vessel, now this vessel is having all the three layer, the trauma breaks the vessel completely. If I draw it, okay, this is the vessel, and the trauma is going to break the vessel completely. Now there is a break in all the three layers. There is a break in all the three layers. यहाँ पे जो break दिख रहा है, this is all the three layers. And so you might ask, why doesn't the blood keep flowing and all of the blood of the body is lost by this hole which is created? No, all of the blood of the body won't be lost. Why? Because there is a process. That process is called as coagulation. Now initially there is spilling of blood over here, and this blood is going to get and become a clot, and there is obviously going to be some neighboring tissues, and these neighboring tissues will also serve as anchor points, and there is going to be a clot over here. And now this clot, thrombus formation, okay, this is going to serve as a aneurysm. So this false aneurysm doesn't have any layers of the artery. Instead, what it's going to have is this clot is going to be there. Slowly blood might keep going inside. This clot keeps getting bigger and bigger in size. And what will happen is, on the other side, on this side, the body will put a reaction on this side, and the body will try to contain this. How it will try to contain this? By putting scar tissue around this hematoma, scar tissue around this clot. So true aneurysm has all the three vessel wall layers. What does false aneurysm has? False aneurysm around the hematoma has scar tissue. It does not have all the three vessel wall layers. Okay. Now what has happened in this case is that the false aneurysm was created on day 0, and this false aneurysm kept on growing, and when the person went out to smoke, the false aneurysm has ruptured. Now this is why a normal angiogram on day 1 does not rule out a traumatic aneurysm. ठीक है, on day 1 you see a normal angiogram. इसका मतलब ये नहीं है कि फ्यूचर में उधर aneurysm नहीं होगा. Now whatever we have discussed so far was of traumatic aneurysms or false aneurysms. How common is false aneurysms or traumatic aneurysms? They are very uncommon. Generally traumatic aneurysms don't form that easily. The number of recorded cases of traumatic aneurysms forming are very less. Most of the aneurysms that rupture are actually berry aneurysms. Now again a question arises. Can a berry aneurysm burst with blunt trauma like a punch? The short and straightforward answer is that yes, a berry aneurysm can rupture after a blunt trauma such as punch, but it is very uncommon to happen. What are aneurysms? They are congenital weak points in the arterial wall. Most of them at the circle of Willis bifurcations. I have already told you this. And when do they rupture? They rupture by sudden spikes in blood pressure, transient intracranial pressure changes. So they rupture on their own. Okay? And most of the aneurysms, they rupture at rest or during routine activities, like for example sleeping, sex, emotional stress. These are the provocating factors. There have been cases when coitus or intense masturbation, they have led to rupture of aneurysms. And many times emotional stress, the stress of the fight, that can rupture the aneurysm. But it's very uncommon that trauma will rupture all the three layers, because like I told you, the aneurysm, it is having all the three layers. So it's very uncommon for the aneurysm to directly burst with trauma. It's going to take its time, it's going to burst on its own. One point I would like to add here is that after a fight or immediately after a fight, the person may go unconscious and the brain aneurysm can rupture. But it is because when a person is getting involved in a fight, it's a extreme emotional state, and at that time there are surges of BP, and because of the surges of blood pressure, the aneurysm can rupture. So the if a person falls down, falls unconscious, and the aneurysm has ruptured, it's not that the punch has broke the aneurysm, but it's the psychological response, the stress response, the emotional response of the fight, that has caused the aneurysm to rupture. So directly the mechanical force to rupture an aneurysm is very unlikely. Possible, yes, possible, but very, very unpractical and unlikely. Now we'll come back to this case. What did the autopsy report of this person show? First of all, there was edema in the brain, massive edema, not a irregular finding. This is a much expected finding. Other thing was, which I have not written in the slide, is that there was subarachnoid hemorrhage. Now this is very important, that there was subarachnoid hemorrhage. We'll discuss it again in the end, that there was subarachnoid hemorrhage in the autopsy. There was tonsillar grooving. What is tonsillar grooving? If you want a detailed explanation, just contact me. I'll explain it to you, or just like write down in the comments. I'll explain it to you. And there was herniation, and obviously herniation, tonsillar grooving, it means choking of the brainstem. And whenever there is an attack on the brainstem, whenever there is a choking of the brainstem, compression of brainstem, immediately the person dies. Okay. So now we'll come back to SAH, which is subarachnoid hemorrhage. So I'll tell you the timeline. This person got punched on day 0. On the immediately he had some subarachnoid hemorrhage. Okay, on the first imaging there was subarachnoid hemorrhage. Then what had happened is, on the consequent imaging, again day 2, day 3, day 4, day 7, day 8, subarachnoid hemorrhage had disappeared and it had dissolved, means it had got resolved. Now again at autopsy you see that there is subarachnoid hemorrhage. This can sometimes misguide the autopsy surgeon, thinking that was there a repeat trauma? No, there was not a repeat trauma. This second subarachnoid hemorrhage which was seen in the autopsy was because of the rupture of the false aneurysm. It was not because of the trauma. Here I have listed out the differences between uh, normal tonsils and herniated tonsils. If you want, you can pause the video and study these differences. Now, in this particular case, what I want to add to the discussion is that in this particular case, doctors have done histopathological examination after autopsy, and the histopathology proves that it was indeed a traumatic aneurysm that ruptured and not a congenital one. ठीक है. So many times this is not possible, that the histopathology so clearly shows that it was indeed a traumatic aneurysm. Now if you are getting the doubt that how can histopathology prove that the aneurysm was traumatic or it was congenital, just contact me, just write a comment, approach to me, and I can explain it to you the way these authors, they have very beautifully explained in the journal. And now, in fact, this is a very rare case which has proved to demonstrate the exact timeline of formation of traumatic aneurysm. Generally, it's not so well documented, and as well as they have given the histological proof of a traumatic rupture of the vessel wall. Many times we cannot give this histopathological proof, and therefore it becomes very hard to predict, was it the berry aneurysm that ruptured, or was it the traumatic aneurysm that ruptured. So it becomes very hard to give any opinion on the timeline of events by just doing the autopsy. Now, why does this case matters? Why so much of discussion on one single case? Now, this case matters because it teaches medical students that early certainty is dangerous. Doctor should not come to dogmatic conclusions. ठीक है. Coming to dogmatic conclusions can cause medical harm. It can also cause legal harm. So doctor should not be too certain very early while dealing with cases. And why students should care about reading such cases? Because no question bank, no PG preparation app teaches you how to sit with uncertainty like real cases do. Real cases, they teach you the gap of uncertainty that exists, whereas these question banks and these preparation apps, they don't teach you this. And other thing is that you learn that traumatic aneurysms intracranial, they are dynamic lesions. Now if they are absent on day one, doesn't mean that they are forever absent. And a normal scan today should never end clinical vigilance. Okay, clinical vigilance is more important than any normal scan. This is what we learn from this particular case. Another thing is that lastly I would like to say is that this case is important not because it is rare. It is important because it reminds us that medicine is not about being confident. Hear to me again. Medicine is not about being confident. It's about being careful. Now the mindset of people is generally that head injury with subarachnoid hemorrhage, it means that the trauma has caused the bleed. Now this case teaches us that the two incidents can coexist without a clear cause and effect relationship. Okay, and so that is why, especially in forensic, you should never be too dogmatic when biology allows you ambiguity. Never be too dogmatic, especially when it comes to clinical practice, especially when it comes to forensic practice. That was today's discussion, where we have taken one case, and with one particular medical case, which was published case, we have discussed one topic, that topic of aneurysm. Generally this is a different approach that I have taken. Generally I take one MCQ, and with that MCQ I try to teach one concept. This time I have taken one medical case which I found that it was very special case, and it was teaching so many things. So that's why I have discussed this. If you like this type of content, if you want this type of content more, so let me know. I'll make this kind of videos more. And like, share, subscribe to my channel. I'm new on YouTube and I want to grow. Okay, so kindly support me.